Hello, I welcome you to this second lecture where we'll be looking at the nursing care for patients with mental illness. And in the previous lesson, we are looking at the general nursing care of the patients, and we looked at the guideline known as Profenema, okay, which was an acronym that looked at different items. A lot of students face problems in nursing patients with mental illness because most of the time we'll be looking at prophenema, something that we can apply everywhere when it's not actually the case. All right, and to make it easier for either in practice or in writing an essay about planning your care for a patient with mental illness, I came up with something to help students guide them on certain items that they need to look at. It is more of an approach to the way they are supposed to nurse patients with mental illness. All right, so nursing care for patients with the mental illness, that is subject that we are looking at today. Right. So the guideline, an acronym that I came up with is CHEBO ARA. So CHEBO ARA is an acronym that gives us the framework of certain things that we need to look at when you're nursing patients with mental illness. All right. To begin the lesson, there are certain items that I would want to actually mention that when we are nursing patients with mental illness, it is more of a syndromic approach. We look at the presenting signs and symptoms, and then we look at the nursing remedy that we need to put there. So in mental health or when you're learning psychiatry, the likes, there are certain skills that you learn about, like communication skills, the counseling skills that you need. So now you need to apply them in terms of therapy when you're now nursing patients. So there's group therapy, there's family therapy, there are a lot of therapy. There's humanistic approach, and then there's talking about the humanistic therapy. So that is very important. So when you have understood the skills that you need to have in nursing a patient with mental illness, then it becomes very easy for you to now, or it becomes easier for you to apply the chemo in the way you nurse patients with mental illness. So now let's go into the details what CHEBO ARA stands for. So CHEBO ARA stands for C counseling. So when you are nursing patients with mental illness, you need to have good counseling skills, or you need to apply some counseling. And when you are counseling, the family needs to be counseled on the issues of stigma so that the patient can recover quite well. And counseling, we are looking at more of the psychological components here that needs to be taken care of. So the family, the individual himself also needs to be counseled on their behavior and the impact that it has on the environment. So they have to be counseled. Right? The community also needs to be counseled. So I'm looking at individual, family, and community being counseled or being educated so that they understand the condition that certain people may have. Remember, mostly mental health cases are not nursed in the hospital, they are nursed at home. So it's important that the community is given the proper counseling so that our colleagues with mental illness can have a meaningful and independent life. All right, so C is for counseling, and I've mentioned the items that actually you need to look at when you are counseling the patient. Then H is hygiene, and of course, table. So H comes in then next. So hygiene, looking at the previous lesson where we're looking at general nursing care. So hygiene, for most patients with mental illness, they are neglected. Okay, they are neglected. So the poor oral hygiene, they have poor hair care, they have poor nail care, they have poor in look at this. There's a lot that is lacking within the hygiene. And I believe that when you are clean, it also improves your mental well being, your mental perception of self. So these patients, they have ended up having dread that they don't want because no one has taken it upon themselves to cut their hair. So as nurses, we are supposed to help out such patients so that we improve their hygiene in terms of those parameters that I've mentioned. So that is the issue of hygiene. Of course, you are free to add in other things because I know you might have learned in your fundamentals a lot of other things to do with hygiene that you need to add on. And this is just a lesson that is now just giving you a guideline on how you can nurse a patient with mental illness. All right. So we have to look also at the environment. The environment I've mentioned before in the previous lesson, we're looking at gender nursing care that there is a physical aspect, there's the emotional aspect, and there's the social aspect. Okay, so all these they have to be manipulated to become therapeutic in nature. Environment is very important. So when looking at mental health, it's either the patient is manic or the patient is a little bit depressed. Okay, so let's have the clinical picture. Let's have the syndrome of signs and symptoms that the patient is facing so that we can understand the nursing care that we're supposed to apply. Okay, so the that is for the item of environment. Of course, you can also use it for exercises, you can use it for any other thing there. I don't mind. I'm just saying this is just a guideline. So you don't need necessarily to stick to it 100%. But I'm helping you so that at least you have certain elements that you need to be looking at that needs to the agency needs to be taken care of when you are nursing a patient with mental illness. All right. So after that, we are looking at behavior modification. Behavior modification. Of course, most patients with mental illness they have an issue with behavior, which is not socially acceptable. So, in modifying patient's behavior, I looked at certain items within the patient that that can be modified, or certain indicators that will give you an idea of what needs to be modified. Of course, I came up with it's an acronym within the behavior modification known as TRAIN, that is TRAIN. Okay, so I came up with this acronym because I was looking at it to say for someone's behavior to be modified, they have to talk about it, or someone needs to talk about it. Someone needs to notice and talk about it. If no one is talking about it, then it's not an issue. It's not an issue to talk about. Then it's a non-starter thing. I've understood after mingling with alcoholics that a lot of people who will soon stop drinking alcohol, they have at one point said they want to stop. They have opened up. People have abused drug. At one point, they have come out to say, I want to stop. But now the addiction, the thing that they are fighting, of course, physiologically, because the craving is still there, so they cannot stop. So you need to talk about your issue, of course, with an appropriate person. Because if you don't choose an appropriate person like a health worker, a counselor, and the likes, then find that your problem is now spilled to everyone, inappropriate people that will laugh at you, and then at the end, you are stigmatized. So it's important to talk. So communication skills there will be applied so that the patient can understand their condition. All right, so what is T? Talk about it. So communication as therapy is very important. Then R is rest. When you rest, possibility of you suffering from depression and the likes become less because you are allowing your body to rest. So you are improving your mental well-being. So it's important to rest for neurological purposes. It's important for you to rest because it is something that helps your body to recuperate. All right, so that is on rest. So it helps in healing the body, meditation, sedation, lighting, procedure done on parts. So procedures can be done in parts and the likes because if you keep on disturbing the patient, what really happens is that the patient will not rest. Okay, so that is the way you can promote rest. All right. Then A is activities. So when you have a patient with mental illness, you have to do all activities away from those things that are stressing them or they are provoking an attack. You have to do that because for you to be good at writing essays or for you to be good at nursing patients with mental illness, you need to identify the certain stimuli that are noxious to the patients. You need to identify the problems that the patient is facing. When you have identified the problem, then that's when you can come up with a good nursing care. So activities, schedule activities for the patients. It's like you are developing a discharge plan. So you need to know that if the patient is able to do these activities, the patient can be discharged, can operate independently. Of course, we know that the patient needs to take drugs so that they can recover. But there are certain activities within the discharge plan which will tell you that the patient is now okay because they will be act as key principal indicators in showing that the patient is actually recovering. All right, so that is on activities. Then I is interest. The patient needs to develop interest in research, the family needs to develop interest in research, and also the caretaker needs to develop interest in what can work for the patients. It's only that which will allow the healthcare provider to know what can be done for the patient. So have interest in the drugs that you are taking. Mental illness may not be cured only by using drugs, but mostly by manipulation of the patient's environment. That's why we need to have interest in the patient's interest in the environment that the patient likes, so that we can know what we can do to help the patient. So that is the issue of interest. Then N is for nutrition. Because most of the patients like fingering foods or foods that they can eat whilst standing or moving about. So you can give them food according to that because it is now helping them. Okay, so that is the train under behavior modification. So under behavior modification, I'm not just saying that everything has to do with the train, but there are a lot of other things that you can do in modifying the patient's behavior. All right. So the next item then that I'll look at after talking about this is what observation. Okay. So here observation when if I have to refer to the previous discussion, of course that marks the basis of all the nursing care that you can ever give to a patient with mental illness. So when we say observation, we are looking at temperature, pulse, respiration, and blood pressure. But for a patient with mental illness, you need to go beyond. You need to go beyond based on the symptoms and symptoms that the patient may have. That's what I'm saying, syndromic management. All right, to make it easier for you on this one, I came up with an acronym on certain things that you can look at when you are observing the patients. So they are under an acronym COST MAP. That is COASTMAP, COST MAP. So when you're observing the patient, look at the level of consciousness. That is found within that acronym. C is for consciousness. Your level of consciousness, if the level of consciousness is a little bit lower, don't expect the patient to function at their normal level. So you need to observe the level of consciousness of the patient. Do they know their name? Do they know where they are? Okay, simple questions that you may need to ask to assess the level of consciousness. All right, so when you assess level of consciousness, also it's important that you rule out intoxication because when people are drunk, they're able to speak French, even when they can only speak English or Bengali. So rule out intoxication. Then orientation. So orientation of location, time, and the likes is important that you see how patients are oriented. Do they know where they are? Okay. So do they know where they are? Location. Do they know the time? Do they know the day? Okay. So you can also assess. I'm using the word assess because you are doing observation. So you are making these assessments. So make assessments on orientation. All right, so it is COA is affect and mood. Look at the patient's interest in the environment. Look at them when they're doing certain activities. What is their facial expression? So A is for affect and mood. So within your nursing art, look at the certain skills that you can apply. Within your scientific nursing, look at certain principles that you can follow in order to apply here so that you can nurse this patient with the mental illness. So affect and mood within the course now. Then I'll say stimuli response. I'll say stimuli response because you need to note negative and positive stimuli. The patient's response. How appropriate is it to stimuli? Okay, you need to observe these things because it will help you understand what may be happening in the brain higher centers there that you may not be able to see. So you need to look at the stimuli response. Okay, so now away from that, we have to look at the next letter, which is T. Okay, we have to look at the next letter, which is T, talking. Talking. And I say talking, observe for pressure of speech and choice of words and raw aggressiveness in the way they're talking. Do they have pressure of words? They are aggressive. That's when you know whether to go near the patient or not. Okay, the language. Within the language that they are using, are you observing any aggressiveness? So talking. There are certain signs and symptoms within actually that you can note from the way that patient talks. Someone who wants to commit suicide. You mentioned at one point to say if the death is more important than living. Of course, it might be based on the economic circumstances within your country. So those are the things. Talking. What are they talking about? Okay? Here, I want you to have a picture of any mental illness, and then you see people with depression. Sometimes it's not that they will remain quiet, others they will talk too much. Why? Because of depression. Okay? All right, so away from T, which is talking, then M, we look at memory. M, we have to look at memory. Here, what we are saying is um, on memory, I can say look at what they are able to remember. If they have amnesia, okay, okay, pre-amnesia, post-amnesia. That's what I'm looking at. Here, I'm saying memory. What are they able to remember? Okay, mental health is a condition known as dementia, and there are also conditions, okay, where there is loss of memory. That way, you'll be able to come up with the diagnosis. And coming up with a diagnosis in mental health is based on the signs and symptoms. Then that's the way you are able to know that now this is this condition. But statistics can come up with all the presenting signs and symptoms. Then you come up with the diagnosis. So you have to observe for all that, or else you'll not have the right diagnosis. So you have to observe for that. All right. So the next item is attitude. What is the patient's general attitude to the environment? Okay. Inquire from the relatives how their attitude has been. Have they observed any changes? Of course, sometimes to understand mental illness, you need also to understand that in culture and all those issues they come into play. So involve the family members, the community, and understand because you might look at it differently when actually that's the way the patient has been behaving, and they have looked at it to be normal. So in mental health, we are saying your behavior should not be of harm to yourself and should not be of harm to others. Then that way you can operate independently. Okay, all right. So now looking at that, and then looked at memory, we have looked at attitude. Then P is perception. Are they having delusions? Are they having hallucinations? So look at the perception of the patients. Or are they altered? Are they having an altered general perception? So P is for perception. Because what is in the acronym? So we have all the ability to look at what is in the course map in the observation, apart from temperature, pulse, and respiration, which are likely to be normal. But I'm saying they are also very important because it also helps you to understand the effect of the drugs that the patients might be facing if they are taking those drugs. All right. So apart from the course map there, then we have to look at the IEC, the necessary IEC that we have to give in patients with mental illness. And please, I'm being biased here by just saying in mental illness. Otherwise, it can still be applied elsewhere. So here I came up with an acronym, the short form of writing doctor, we say DR. So we say doctor, speech. So doctor speech, that is speech is SPEECH. So this acronym is to help you with certain items that are needed within the IEC for patients with mental illness. Don't restrict you to follow this guideline. I'm saying you can add some more. I'm trying to make your life easier if at all the lesson is having an impact. Doctor speech, drug adherence. D is for drug adherence. Patients may be on treatment for a long time, so it's important to adhere in order to avoid relapse. Drug adherence. All right, so from D, drug adherence, R, we are looking at review. Patient may need to be reviewed each and every time so that we see the progress. If you don't respect review dates, then the drugs will not be restocked. You will not know whether there is need to change the treatment. So drug adherence is very, very important. Okay? Adherence is very important in all other diseases, but I'm saying here it's for mental health, drug adherence. Okay, so it's Dr. Speech. S is support groups. Okay, support groups. In our communities, most of the recreational areas have been turned into plots, malls, businesses have been built there. So we don't have really support groups that you really need to talk on behalf of citizens that need to mingle in these social areas. Support groups are very important to help the patient recover. Okay, otherwise it will be very stressful if you don't have areas where you can mingle socially. Because even I need to play football for the potential actually to even be appointed in the national team. I'm a very good footballer, but we don't have a lot of places where we can go and play football. So the talent has just died out like that. Okay, so we need to have areas like that. All right, so the next part we are looking at is education about the condition. Patients need to be educated about their condition because it will promote cooperation. It will make the patient understand himself better and the impact that the disease has on others. That way, the patient will also comply in taking treatment. Patients need to be educated about the condition. They need to be educated about the impact of their disease on others. That way, they will comply. All right, so I'm expecting you to add more because I'm building this knowledge from the mental health skills that you have, mental health therapies that you might have learned, and the fundamentals of nursing that you might have learned, which forms the basics of nursing care. All right, so the next item that I'm also looking at is the environment. Environment needs to be manipulated for therapeutic purpose. Remember the physical, the emotional, and the social aspect of it needs to be manipulated so that the patient can recover. All right, so we can also now talk about in Dr. Speech, we can talk about C, career modification. After mental illness, sometimes society fails to accept people who have recovered. So there should be some career modification so that the patient can sustain themselves economically. Or else the issue of mental illness will take an economic dimension. So it's important to have some career modification in case you are not after recovering, the patient is not just mentally fit. So they need to be doing something that will economically empower them. All right. So then the other aspect is also hygiene. So what I'm saying is that patients, even after they have recovered, they need to look clean. They need to be smart. Okay? Because if at all they return to the same date that they were in within the community, then the patient cannot recover. You know, when we talk about Dr. Speech and it's talking about the environment, someone who's abusing drug, after you discharge them, they go back again to the same environment where they are still abusing those drugs. You will find them that they will still go back to the same. So change that environment. Okay? So that environment is not hygienic for the patient. All right. So on Dr. Chevo, I'm very passionate about it because I know it can help it. It can help a nurse. It can help a health worker out there come up with a framework of nursing a patient with mental illness. Please, I'm encouraging you to share this video. If at all it has helped you in any way in nursing patients with the mental illness or in the way you're going to nurse patients with the mental illness, please share so that a lot of healthcare provider out there they can understand or they can learn something from this. Please, when you subscribe to my channel, you'll be able to get other lessons that I'll be presenting, and it is free. When you subscribe, you'll be watching all these videos free. I just want to support nurses across the globe with what I believed are some of the concepts, some of the frameworks that can help them improve in the care that they give out there to our patients. Nursing is our passion. There's no nurse who's better than others. When you have entered the profession, we are all the same, and we have a part in improving the lives of our patients out there. So it does not make me a better person when I stand here to teach you or to help you in these areas. I might also need to learn from you on other things that you need. So I appreciate a lot of feedback or certain elements that I might have left out here. You give me feedback through my email address. You can give me feedback underneath there through some comments on my YouTube. Then I'll get back to you. You can even suggest new topics that I can cover so that we can improve nursing, which has been in existence for 400 years.